Hello and welcome to the EduTalk series hosted by Biotone EduPartner Program, and massage industry experts. With the growing interest and popularity of the EduTalk series, Biotone continues to support virtual learning and building massage community by connecting you with industry experts who share their knowledge and expertise on topics not only for class discussion, but career success. Tonight's expert is Dr. Tiffany Ryan, PhD and LMT, who, after earning her PhD, decided to learn integrative care. She returned to school for massage and yoga, where she focused on incorporating the mind-body connection to improve overall well-being. In 2018, she co-founded Yomassage, a fusion of relaxing and supported restorative poses with hands-on massage therapy and mindfulness practices. Let's listen and learn as Tiffany discusses trauma-informed bodywork, knowledge needed to do no harm. Tiffany will address the importance of bodywork in treating clients who have experienced trauma. She'll review in-depth trauma 101, trauma and the nervous system, and how to engage with clients in a trauma-informed manner. It's an important topic, and thank you again for joining us. Please be sure you're muted and video is off. Tiffany, I know you have a lot to get to, so I will sign off and see you at the end of your presentation.
Okay.
And thank you again, everyone. Here we go.
Here we go. All right, let me share my screen here. Okay. And we'll get into slideshow. All right. I am going to move this little guy out of the way. Okay. So I am Tiffany Ryan, as Donnell introduced. We are going to be doing an introduction to trauma-informed bodywork. We obviously, have kind of a short time together today. I have all of the slides from our Intro to Bodywork course, or part of the course that we offer at Yomassage. I'm probably not going to go through all of them in depth, but I wanted to share them with you all so that you have those slides. We'll go over the main points in the time that we do have together. And then, of course, I'm open for Q&A and just, email questions and whatnot after this. Okay. So Donnell already went into my background, but just so you know, we do at Yomassage. Yomassage is a continuing education provider for massage. We have several different trainings, and once you are certified in one of our offerings, we do offer a trauma-informed bodywork certification as well. So this is like the intro to that, and then we have a much more in-depth training that you have access to once you train with us. So I wanted you all to just kind of take a moment and think about why you're here right now taking this training. As body workers, we want to help people, and the best way to help people is to arm ourselves with as much information and training as possible to make sure that we are giving them a session, a service, a time where they can actually enter into that healing mode for themselves, and we're not introducing anything that's going to do harm. And I'm really happy to see how many people signed up for this training. This is, in my opinion, something that a course that should be taught in every massage school as part of our just basic training. So I already went over this. Okay. And the reason I say this is because 70% of adults in the US have experienced some type of traumatic event at least once in their lives. Okay, we really can't escape life without experiencing some trauma, or most of us cannot. And so, in Yomassage, it's a small group environment. We serve up to 5 people at once in a small group session. Well, that means in that class of 5, it's likely that at least 3 of those clients have experienced some type of trauma. And if you think about that just in terms of your individual massage practice, that's, of every 10 clients you see, 7 of them have experienced some type of trauma. So, what is integrative treatment? Integrative treatment is essentially just the opportunity to work with other health and mental health professionals as part of a collaborative approach. And so if you are interested in becoming, certified in a trauma-informed approach for Bodywork, then you can collaborate with other folks to treat that population specifically. But as I said, with the 70%, you don't even have to be advertising that specifically to know that you are going to have people coming into your practice that have had, some experiences that we want to be mindful of. And so, okay, 7 out of 10 people, what does that mean? There are different levels and severity of trauma, right? It's not all created equal or experienced the same way. We can't assume that because someone has experienced a certain type of trauma that they will have the same symptoms or response as somebody else who has experienced even a similar trauma. What we can do is arm ourselves with information about what trauma is and what the potential implications for the physical body are, as well as the mind-body connection and the client's mental health. So you've probably heard the term PTSD, and while some clients will have PTSD, this is post-traumatic stress disorder, it's a diagnosable disorder, many people who have experienced trauma will not have PTSD. So again, it's about the severity and how the symptoms manifest that determines if it's PTSD or not. For your work with your clients, it really doesn't matter if there's a diagnosable PTSD or not. You are really just taking into consideration these practices for being mindful about all kinds of potential triggers that you're going to implement with pretty much everybody. Okay, so I'm going to skip over the PTSD part here, but a traumatic experience might be labeled something that causes PTSD. It might be threat of death, serious injury, or sexual violence. And it could be either by experiencing it personally themselves or witnessing it happen to someone else, or even learning about it happening to someone you're close to, or being repeatedly exposed to details of a traumatic event from somebody close to you that you that they speak to you about it. So some of the symptoms of trauma are having distressing memories of the event, recurrent dreams related to the event, flashbacks, or feeling as if that event is occurring right now, feeling on the edge or being startled easily, avoidance of things associated with the trauma, like memories, thoughts, reminders of things like people, places, or things. And so really what we're doing when we're working with our clients is just being mindful of what things could potentially cause the symptoms to appear or get worse. So some of these things could be a smell, a location, a song on the radio. These can trigger the fight or flight response, which is, we know this from our education around the nervous system, right? The fight or flight response is when we're just trying to protect ourselves and we got to get out of here. We got to either flee or we freeze or we become aggressive. So those are the three ways that trauma manifests in the nervous system. This can look like anxiety. Um, you know, when a client is entering into a situation where they don't know what's about to happen, maybe they've never received massage before, they don't know what a session looks like, they're not sure what to expect, that can cause anxiety. And so we are wanting to make sure communication is the number one thing that we are focused on with clients. So if they know exactly what to expect and that they are able to communicate at any time if they want something to change, that can really help us mitigate some of that anxiety. So, of course, as we just talked about with trauma, there are different levels and types of anxiety. Some is problematic and some is just normal and helps us get through life. So it's an emotion, it's a natural part of life, a natural part of being human. But for some people, it can become excessive to a point where it's impacting your daily life, ability to engage in different activities and functioning. And so it's when it hits that point that we kind of determine, okay, this is something that needs to be addressed a little bit differently than we would with somebody without that diagnosis. So what I love about massage is that we have this unique opportunity as body workers to provide a space for healing. And I think massage is essentially induced meditation or an opportunity for it, right? Because meditation or mindfulness really is about clearing out the other stuff that's going on in our heads, the things we're worried about, the things we're angry about, upset about, whatever. And we're just focusing on the sensations we're feeling in the body. And so when we are guided to do that and we feel in a safe space to do that, it gives our body and our mind an opportunity for healing. Okay. So every training at Yomassage has a module on trauma-informed approaches. We incorporate this into everything we do. But it's never something you're just going to know everything there is to know about trauma informed. It really is just a practice of being mindful about what's happening in your room and in your interactions with your clients. So this can be your one-on-one interaction with the clients. It can be even when they walk in the door, if you're at like a spa or somewhere where there's a different person at the front desk. It can be in how the room is set up. So there's a variety of different factors to consider outside of just the way you're approaching body work with them. So, okay. We want to understand the symptoms of PTSD so that we know how to recognize them and then what to do once we do recognize them. So we talked about the re-experiencing symptoms, the dreams, the flashbacks. The avoidance symptoms are more staying away from things that are going to trigger them or remind them of that traumatic event. So that's important. I covered this briefly in another slide, but even the type of music we're thinking about using, right? We want to avoid music with words or sudden sounds or even, drumming. We can never know exactly what's going to trigger somebody, but we, again, can be mindful and think, okay, there is a likelihood that perhaps, some of those things could trigger somebody. Same with smells. This is something in your intake that you're going to want to cover, especially if you have clients that have a background that has some trauma. So, you know, is there a smell that you would like to avoid? Are there, sounds that you want to avoid? When you're thinking about setting up your room, set it up in a way where it's free of obstruction, that perhaps they're facing the door, the back isn't to the door, things like that. So again, you can think about this being easily startled, feeling on edge. What might easily startle somebody? An example of this that we have at our spa is when we put eye pillows on when we flip to supine. Well, I'm gonna let them know I'd like to put an eye pillow on. Are you okay with that? They consent to having an eye pillow on. And then it's a very gentle application of the eye pillow. And same when we're taking it off. I'm going to remove the eye pillow now so I can start work on the neck or whatever it is that we're doing. When something is done to your body, and especially something where it's like sight or hearing, we want to communicate that and get consent. So it's might feel a little bit like over communication if you're not used to working in this way, but it really gives people a sense of safety and agency in their own session. Okay, I don't think we need to go over these details. We're just getting the highlights here. Okay, so this plays into what I was talking about in our unique opportunity to provide that time for clients to reset their nervous system. The body can become wired to expect trauma. So when we're in a constant state of arousal and stress, then we just become used to that. And the tiniest little thing sends us right there. And it wouldn't normally, that's not something, whatever that tiny little trigger is or stimuli is, might not be something that puts us in danger or that actually should trigger that part of the nervous system, but it does because we are just used to going straight there. So the longer we can keep people in this state of rest and relaxation, the longer the body has to get used to being in that state. The longer the body is used to being in that state, the body and mind are used to being in that state, then when we have something that comes up that we don't actually need to protect our body from, a significant trauma, then we can more easily come over into the, okay, I'm gonna assess this and now I know I'm okay. I'm gonna stay in my relaxed state, right? I don't need to jump over to this fight or flight response. So we have a real opportunity to help people in their lives outside of their work with us, right? It's amazing. Okay, so in terms of the communication, we always want to start our session with an introduction of who you are and what clients can expect during your time together. So we know that rapport building is important regardless, but it's important that if you are wanting to implement a trauma-informed approach, that you really do take the time to do this, and that the client feels comfortable and knows that they can communicate their preferences, needs, desires with you, and that they know what to expect from the session. So, we want to avoid giving like too many specifics, right? Because that can actually cause maybe some more anxiety where it's like, first I will do this, then I'm going to do this, then I'm going to do that. That's a little too much, but just knowing, okay, we're going to do some breath work, and then I'll be, performing massage, and we'll flip over halfway through, and then, we'll have an eye pillow and some essential oil and, whatever it is that your structure is, just letting them know that's what's going to happen. And feel free to let me know if at any point, and I'll check in with you if we'd like to have anything be different. Okay. That's so, like, I really can't stress that enough. That open communication and rapport is probably the most important part of all of this. At Yomassage, we focus a lot on breath work. I know not everybody does that in their sessions. I think you should. I think everybody should. It's a great way to regulate the nervous system and teach your clients some tools to regulate their own nervous systems when they're not with you. But breath work can be anxiety provoking for for some folks. They might go into a state where it's like, oh, if I focus on my breath too much, maybe I'm going to hyperventilate or stop breathing altogether. And so communicating with your client that, you are going to engage in breath work before the session gives them the opportunity to say, you know what, I actually don't like that. I actually don't want to do that. And then that that's not something that's going to be productive for your client. If you do decide to incorporate breathwork and your client feels okay with that, another way of being mindful of how to do that in a way that won't, bring on anxiety for some folks is just making the language flexible. Feel free to follow my guidance, or listening along to my guidance as we breathe is optional. Do whatever feels good for you. Everything's a suggestion. We're never mandating anything, or, I'm sure many of you have done yoga or done some breath work, and I get like this if my instructor is like, breathe in for, to the count of 6, and they do to the count of 6, but I stopped I can't take more breath after the count of 4, then I start to feel like, oh my gosh, do I have to go to the count of 6? And so it's very important to just let folks know to do whatever feels good for them. That's the whole point of it, right? It's an invitation for choice. In terms of the environment, keeping the lighting soft, very bright light and very dim light can both have negative effects. So dim lighting can give the experience of semi-privacy, so they don't feel like the lights are on them, when they're in a session. And, if it's too dark and they can't see what's going on, that can also be an issue. So just making sure that the lighting is appropriate. We talked about the music at our spa. We play the 432 hertz soundtrack. There's nothing, no, drumming, no startling noises. There's no lyrics. It's very predictable, which is what we're going for. Okay, this is really important too. I actually just got a massage at a very fancy resort, and I've had very high expectations, and the pace of the massage was so fast. My nervous system was completely dysregulated. Pacing is really important. Moving slowly, maybe even in unison with the client's breath, is a way to help keep the nervous system in the rest and relaxation and calmed state. So, and I know, well, maybe this is just me, but when I was in massage school, I remember whatever the music would be, the rhythm of the music would be that was playing, that's what the rhythm of my massage would be. And I had to work really hard to not do that. So if that's an issue for any of you, just being mindful of, okay, the music is a little faster than I think, my strokes should be, to really focus on slowing down the strokes. If the client feels that you're rushed or you're pressed for time, there's a sense of urgency coming through, that's not going to be good for their anxiety levels. Okay. Session tips. So, when somebody has experienced trauma, a sense of safety and choice has often been taken away from them. And so that's why the communication piece is so important. We want to be making sure that the client has this sense of agency and choice in everything that we do. So that's just the impetus behind that. And I know I have talked about this multiple times, but that's because this isn't rocket science necessarily, right? This isn't something super complicated. It really comes down to the basics of communication, choice, safety, and just being mindful. So So that's why I'm going to hammer that home. So if you do want to work with clients that you know have experienced trauma and you are doing a trauma-informed bodywork session that's specifically tailored for that, you want to add in some extra time for your verbal overview of the intake. You want to make sure that that rapport is being built with clients, and that they feel comfortable receiving bodywork from you. So when I first started doing massage, well, my background's in social work, as Donnell had mentioned. And so when I first started doing massage, I worked at a place called the Integrative Trauma Treatment Center, and I did massage and energy work with clients who were sexual assault survivors. And so the building rapport, I mean, some of these clients had not wanted to be touched at all post their traumatic event, and this was our introduction of touch in a safe way so that the body can over time know that it is okay and safe to be touched. And so to allow someone to touch you after a trauma like that, you really have to have a rapport and understand what is important to them in the session. Often for that, we start working away from the area of trauma, the point of the body furthest away from where the physical trauma was. We encourage the client to observe the sensations in their body. Being present as the therapist in these sessions is so important. So, I mean, I would say that in any session, regardless of if there's a trauma involved. If you're not present, your client can feel it and they're not going to trust you. If you're distracted or not fully focused on what's happening, yeah, they're just not going to trust you. So being present is extremely important. You noticing what's happening. Oh, do you notice the breathing shifting? Do you notice maybe they're starting to clench their muscles? Do you notice that they're holding their breath? Really paying attention to what's happening to your client so you can help them work through it. So, so important. You want to make sure that you've done your, full intake and that you maintain your own boundaries as well. So, sometimes clients will want to engage you in conversation around their trauma, and we need to know our boundaries as massage therapists and what we can really ethically engage in. Listening, validating, I see, but we never want to then engage in conversation really about the trauma. That's just out of our scope. Okay, so we talked about being in control, working away, moving slowly and with purpose. If you are working with a client that has a specific trauma, like I said, you will want to communicate what you're doing and where you're headed next. So, all right, you've started at the feet. I'm going to head up to the start working on the calves now. Avoiding medical language that the client might not know what it means. We don't want to label body parts or muscle groups how we might speak about them as massage therapists, but more in layman's terms. You want to avoid wearing scents yourself, or even having detergent scents. And okay, we already talked about that stuff. It is 3:30. I just want to, I'm going to click through these slides so you know what else is here. And so when you do get the slides emailed to you, you know if you want to take the time to look at them. So there's some information on language that you can use. We really want to avoid, speaking about the body in a way where it's like, well, in Yomassage, we're guiding people into stretches. So there are ways where it's like, oh, you could say spread your legs. Well, we're not going to say that. We're going to say, take your legs, to either side of the mat, or let's take our heels to the edges of the table or something like that. and just practice communicating with your clients. Making sure we're asking what feels good and not assuming. Again, communication. Okay. Let's see, sense of choice. We have lots of content here. We talked about scope of practice, not engaging in the traumatic story. Of course, listening with empathy and not cutting someone off, but just, not engaging or providing advice outside of your scope of practice. Okay. And then I just want you guys to consider, if you are interested in really learning more about trauma, about bodywork specifically with trauma, these are my go-to books that or resources that I really, really love, and that I even recommend to my clients who are, dealing with trauma. The Body Keeps the Score. I'm sure everyone's heard of that by now. That's been on my shelf for a solid decade. Trauma Stewardship is another amazing book. And You Are the Placebo. You Are the Placebo really gives some agency, I think, gives the client some agency in terms of their own healing, and allows them to start engaging both the mind and the body in their healing. So I recommend those. Network with mental health providers that value bodywork and integrative care. Introduce yourself to them. Maybe suggest grabbing a cup of coffee and being part of each other's referral network. It's really cool to be part of a team like that and see the progress that clients can make with an integrative approach to treatment. So I told you that we are a continuing education provider at Yomassage. We are offering 30% off of all of our certifications for the Biotone participants, valid through February 11th. And you can check out our website, it's yomassage.com, but we have one signature training that's floor-based where we serve up to 5 people. And we also have a table-based version, a barefoot version. We've got a lot of different stuff going on there. And like I said, once you take one of those certification courses, you then are eligible to take our trauma-informed bodywork certification as well. And those are just some references. So you guys now know some basics, right? Communication, mindfulness of the environment, and what some symptoms might look like in somebody who has experienced trauma. But really, it doesn't matter, again, the severity of it, or even if we know if the person has experienced that trauma. It really is more, we're just anticipating that 7 out of 10 of our clients have some kind of trauma that we need to be mindful of in how we interact and approach our clients. So that's it. And we'll see if I think the chat has some questions.
Well, we still have time for questions. Yes, the recording will be available. And in fact, I'd like to invite and encourage all of you to visit biotone.com, and the EduTalk tab has an archive library. And EduTalks were launched in July 2020, thanks to COVID, and one of the benefits of COVID. And you'll find a wealth of information and presenters sharing their knowledge and expertise there. So I'd love to encourage you to go there. Tomorrow, you will receive a follow-up email. And in the email, it will have a copy of tonight's recording. It will have a copy of Tiffany's PowerPoint presentation. And it will have contact information, as well as a reminder of the discount offer she's extending to everyone participating with EduTalks for continuing education. Let's see, Sophia is asking, are the trauma-informed classes in person? Do you offer in Oakland location?
They are not in person. It is virtual. So it's at your own pace. And I think it's total, it is seven hours, I believe, 7 or 8 hours for the whole bodywork certification.
All right, and she asked additionally, will I need to certify in Yomassage facial first?
So it sounds like you're an esthetician or going to be. We do have Yomassage facials for estheticians as well, which is, side note, super fascinating that there's mind-body skin connection. That's a whole area that I find so fascinating. Our skin, our largest organ, is super impacted by our mind-body. Or by our mind. And yeah, so we think Yomassage facials is very cool. Yes, you would need to certify in Yomassage facials before, or Yomassage signature barefoot, one of our main trainings before you're eligible for the trauma-informed body work.
Tiffany, if you wouldn't mind closing the screen so we can see more of you for our questions. I did think that you brought up some excellent points, being the communication and earning someone's trust.
Mhm.
Regarding the intake form, and I've been getting massages for years, I don't think I've ever been asked, aside from, is anything achy today or anything I should work on? I really never have been asked if I have an emotional issue or, some sort of trauma. And I really do think that that's something to expand on an intake form. You don't have to know exactly what the trauma was,
Yeah.
but to just know that this client might have certain sensitivities or issues. I think that's very important. And
Yeah, it definitely is. Anxiety, depression, PTSD, any of those things. And really, I mean, you can ask that specifically, but then there are other questions that you can ask that kind of deliver that same information without asking it directly as well.
okay. I've had some massages where the therapist has talked the whole time about aliens. Now, I'm happy to listen about aliens, and who knows, they might be among us, but that creates kind of a tension for me because my mind has to be engaged,
Hmm.
and I'm not going to say, please be quiet. So, do you have any recommendations as a
Well,
therapist might be creating some stress and
100%. Yeah, I mean,
minimal?
you shouldn't be talking about anything besides asking the client about how things are feeling or their preferences. Or, maybe a mind body cue with breath work or something. Yeah, definitely no extraneous conversation. And also, I just kind of want to piggyback on your comment about the intake. If you are going to be gathering this information and asking and, diving into this personal information, the preferences, if you don't actually follow through on accommodating those requests or considering what that client told you, that trust is completely gone and they're going to feel probably violated. I mean, I think on a very small scale with that, when I go to massage and I say I have a knot in this shoulder that is really causing me pain, and because they asked, is there something that's bothering you? And then they don't actually address it and they just do their normal routine, I feel really upset. I feel like you asked me and I told you and then you ignored me, and that doesn't feel good. And that's not being present with my body. That's not being present with me. And so that's not a trauma issue, but you can extend that, obviously, if you asked about something that's to help them feel safe related to trauma and then you ignore it, that's just probably the worst thing that you could do. It's worse than not even asking, right?
True. And again, I thought the breath work was very interesting as well. And also had massages where I just felt the therapist was rushing through it, which again creates that, I mean, it's low level anxiety, but you're feeling, I'm not relaxing, you
Mm-hmm.
know, and I'm not always, you know, I'm like, okay, I'm just gonna accept the massage as is. This is might be their style, but I also think now listening through this as well, it's my responsibility to say, can you slow it down? Can I have silence? And
And that's so hard. I mean, it is just
it
so
is
hard to
hard.
ask as the client to do that. And so it really is our responsibility as therapists to provide those opportunities for the client to speak up. And gosh, yeah, I mean, I have trouble asking for what I want on the table for whatever reason. It's a thing. And that's what I say. That's actually part of my rapport building is I will tell the client, um, I don't know, there's this weird thing that happens when we get on the table, and it happens to me too, where we just don't want to ask for what we need or say that we want something different. And I just want to acknowledge that that's a thing. And let's promise each other today that you're just going to tell me because, you know, and so you just acknowledge it, call it out, communication, and it really can help.
And it could be that you go into a massage thinking that I'm seeing a professional
Right.
and you want the professional, the knowledgeable professional that will be tuned in and offer you the best massage possible that they can do. I did see some other chats come in, and one school had, and thank you, San Francisco Institute, um, estheticians and cosmetology, and I might not have gotten the full name right, but it was wonderful having your full class there and the instructor. We are going, one of the questions, we are going to be estheticians and we are learning facial massage now in school. If you can explain facial massage, will be so helpful.
So our Yomassage facials is specifically for estheticians, and we you can either do it in a small group up to 4 people, or it can be one-on-one on the table or on the floor, I suppose. But we walk the clients through restorative stretches. For the facial program, they're all supine stretches, obviously, because we have to address the face, and we use it's a waterless facial because we could be doing it in a studio on the floor, and we work through several different types of products. I believe it's a 5-step facial. We use hydropeptide as a partner for that, and they are guided through meditation and mind body prompts, breath work throughout those sessions. So it's a spin-off of our signature Yomassage, but for estheticians.
Great. And Leanne is asking, commenting, we are not the high priest, but the medical industry maintains the high priest aura.
Yeah.
So again, I don't know if it's an improvement on the intake forms, if it's totally tuning into every individual client that comes in. You did offer excellent points about creating an environment, an atmosphere to be calming. From music to the positioning of the table, I took it so they're not facing the door. Um, we do have another minute or two for more chat questions. It really, I think, takes a good base of knowledge to recognize a client that might be experiencing trauma, because I don't think everyone would want to mention I have trauma or I
Right.
had this. I mean, maybe they'll say I had a car accident or I fell down the stairs,
Yeah,
but
and we don't, like I said, unless you are really wanting to work with somebody in an integrative care fashion, we really don't need to know. We just need to be mindful of how we're interacting with everybody. And often, like, the trauma can present itself as maybe somebody's angry about something at the front desk, or they're feeling agitated, or, and that could be a symptom. We don't know. We're never going to know, and we don't need to know all of the details. We just need to be mindful and communicative and present with all of our clients and see them as unique individuals.
Right. And I think synchronizing breath with the client as well. Leanne also mentioned, which made me think of feng shui. I think they want to be facing the door, feeling safe so they can get out.
Right. So the door should be in sight. Exactly. Yeah.
And that might be something that the therapist says is, the door is right here and feel free to stop me, or I think it's something that can be incorporated as a courtesy,
Right.
perhaps.
Yeah, and it's just easy. You float it into the conversation, and there's not clutter, there's easy access to move around. All these things are, I mean, they seem small and simple, but combined make a really big difference.
Yes. Well, again, thank you so much. This is such an important topic and kind of somewhat hidden. Sometimes I think you'd have to bring it out in the client to share. It's excellent information. Again, watch your inbox tomorrow for the follow-up email with recording and handout. If you don't see it by tomorrow afternoon, please check your junk or spam folder. And please join us for upcoming Edu Talks. We've gotten 2024 off to a great year. February 6th, we have Irene Diamond presenting on.
Irene is a Yomassage therapist.
Oh, wonderful.
Yeah, I know Irene. She took our training.
And she's presented additional Edu Talks for us as well. She's presenting a unique approach for a damn great massage, and that's the Diamond Active Method massage, February 13th. And for those of you who are not familiar, we launched the Edu Talk Diabetes series last May. And we do have an Edu Talk Diabetes series on February 13th with Wendy White, and she is presenting massage considerations for diabetes clients and patients. And then we end the month on February 20th with Dorothea Atkins presenting a proven new approach for osteoarthritis joint pain. And both Irene and Dorothea had presented before, so you could find their Edu Talks in the archived library on biotone.com. So thank you so much, everyone, and be mindful of your clients and what they're not saying, I guess, is the best way to share that. And join us again. Thank you to you, Tiffany, and learned a lot, super helpful, and doing good work. Thank you, everyone. And congratulations to students in school, and continue to join us for Edu Talks. Take care, everyone. Be safe. Tiffany, thank you as always. Wonderful chat.
Yes, thank you, everyone.
All right. Good night, everyone.